Now, the prevalence of overweight and obesity and IBD has changed substantially in the past 20 years, very similar to the general population. Now, in a study that we recently completed in Alberta, we identified that 50% of patients with inflammatory bowel disease are either overweight and or obese. This is a dramatic increase compared to the rates even 20 years ago when malnutrition or being underweight was a bigger problem in those individuals with IBD. Being overweight has impact both on IBD, overall natural history and course, as well as on general health. There was a nice study reported on earlier this year and presented at a major international Crohn's and colitis congress. And this group of investigators tried to understand the associations between being overweight as determined by visceral fat. Now, visceral fat is the fat that is located around the organs in the abdomen. It's not the fat that you can pinch under the skin. The investigators, the researchers, they divided close to 100 patients into 4 groups, either having or based on the amount of overall visceral fat in and around the organs. So they were grouped either into having high levels of fat, medium levels of fat into 2 categories, and then the lowest levels of visceral fat. And they followed these patients out for 1 year. And they identified that those patients that had the highest visceral fat compared to the lowest visceral fat were much less likely to achieve inflammatory response based on colonoscopy. They still had active ulcers and active evidence of inflammation if they were in the highest quartile of having visceral fat. In addition, the highest compared to the lowest fat groups were less able to achieve remission and come off their steroids if they were using it because they had active symptoms. So being overweight and or obese may impact your response to biologic and other medications. And this is also in addition to its known detrimental effects on blood glucose control, diabetes, and heart disease.